The Department of Health says their MEC in Limpopo has a point about foreigners taking up resources in government hospitals. But she could have aired her grievances in a more appropriate forum. A video showing Dr. Poppy Ramathuba chastising a foreign patient in a Bela government hospital has drawn sharply divided views. Some saying it's xenophobic and unethical, others saying she's got a point and foreigners must get to the back of the queue. Well, the MEC is also a medical doctor, and of course all doctors take the Hippocratic Oath, a pledge to preserve life and do no harm. So has she erred in that regard? I'm joined now by the president of the Association of Medical Councils of Africa, Dr. Kgosi Letlape. And Dr. Letlape, earlier I referred to you as the president of the Health Professions Council of South Africa. You have in fact moved on now to this Africa body, which really unites all these various councils. So it's very appropriate that we're speaking to you because, of course, the MEC was pointing a finger at other people from other African countries who come here for assistance. But first of all, what did you think of her comments, bearing in mind that she's a medical doctor?
I think her conduct was bringing the profession into disrepute. That is not how we treat our patients. And the conversation she could have had with that patient, but in a more professional manner, without ridiculing the patient. But also, it is not a setting to have that type of conversation with the patient when someone is still in bed and is still receiving care. So it's an engagement that could have happened at a better time. But even when it happens at that time, it should happen in a humane manner where there is proper, respectful engagement. We need to understand as doctors that when we see patients, patients look up to us for assistance, and we need to fulfill the oath that we take to put the interests of the patient first.
So it's interesting that you now work with the Association of Medical Councils of Africa. I would imagine that this video is going to be a subject of quite some debate. Looking at it, do you believe that she was xenophobic?
No, I don't think she was xenophobic. We need to understand the stress that the public healthcare system is under. The fact that the government and the privileged citizens do not devote enough resources for the care of the less privileged, the 80% that depend on public service. We also need to understand that her ethical responsibility in terms of the Hippocratic Oath is to ensure that those that depend on the services that she's responsible for get quality care. So numbers are important in that consideration. So when you have too many people for the budget that you have, it compromises the quality of care that they should receive. But upholding her oath in that respect should be to speak to cabinet, to speak to her colleagues, and to ensure that other ministers do their job in terms of having secure borders, so that when we have citizens here, they are documented. And as healthcare practitioners, we do not have the challenge of discriminating against practitioners because of immigration status. That should be sorted by the immigration authorities. And once you land in our facilities, as has happened with this patient, you'll get the care that you need as mandated by the Constitution and the oaths that we take.
So what exactly does the Constitution say? Because my understanding from speaking to the Deputy Health Minister is that we have an obligation in South Africa to treat anyone, certainly with primary health care. But my understanding is that beyond that, if someone arrives at your hospital at death's door, you don't do a little questionnaire to find out if they're legally in the country. I mean, after all, doctors have to treat criminals. You can't go, well, I have a problem with that person because they've killed X number of people. So what are the obligations when someone arrives at a hospital in terms of where they come from? Does it actually matter, or do you simply treat them?
No, it doesn't matter. Remember that it's also not the job of healthcare professionals to do that screening. That's administrative work. We are in the front line. Once you've made it to the front line, your duty is to treat. Whether it's a convicted criminal, whether it's someone that has committed crimes, when you sit out there, your duty is to the patient that is in front of you, irrespective of where they come from, their religion, creed, citizenry, that really is not your call to make. Your call is they come to you as a healthcare professional, and you have a solemn oath to act in the best interest of the patient.
Would you say
and let's remember that this setting that we're talking about was not a clinical setting. In that respect, our colleagues in that hospital had done what needed to be done for the patient. The problem becomes that there are certain implications that if you are not a citizen and you've been given care, you need to pay for the care that you have received. But that should have been approached in a humane manner. I think we should not confound issues where, with respect to medical care, that isn't an issue with the patient that was in the video.
And certainly, if there's a problem with the policies, then that needs to be directed to the policymakers and to her own government. What do you make of the potential implications of humiliating a foreigner in front of a group of people in a video that's now gone viral? Do you think that's potentially problematic? Do you think it could entrench views that it's okay to tell foreigners they really are at the back of the queue?
I think just like we do not discriminate irrespective of where you come from in terms of giving you treatment, even in terms of treatment, it's not because she was a foreigner that it is not acceptable. It's because she was a patient, irrespective of her immigration status. So this should not be seen as a form of xenophobia. It is unprofessional conduct. Because nobody can say if she was a South African citizen, this behavior would be acceptable. So it has nothing to do with citizenry. It's about how we conduct ourselves as professionals. And we need to ensure that abuse is taken out of the system. But there's also a responsibility to ensure that we have an enabling environment to have happy, energized healthcare professionals that take care of the population.
But is it fair to blame foreigners? You know, I've spoken to a xenophobic group yesterday who said foreigners are being scapegoated when in fact the real problem in hospitals is corruption, unskilled people, lack of resources, but it's largely to do with the policies that we've made in South Africa. It's not fair to blame the foreigners. They're a very easy and vulnerable target.
No, I don't think that is true. There are multiple factors. Corruption is one of them in terms of how the system is not working. But one of the things at the top is separateness, apartheid in health. Me and you, Sally, don't have to worry about this happening where we get our own healthcare. Because thanks to the parliament that we have today, we have been segregated through the Medical Schemes Act to have private healthcare. And we are not impacted as the ones that lead. So the biggest contributor is apartheid in health and separateness. So we administer systems that we do not get our own health care from.
Yeah, this government's had nearly 3 decades to fix that, and they haven't done that. But I want to ask you a question, a more broad question about... Before that, Sally, the reason they have not been able to fix that is that they inherited a lemon. They inherited a system where they were outwitted, given a Medical Schemes Act, which becomes privileged health. And where I agree with you, and it should be a collective responsibility of all of us as citizens and as South Africans, that we have elected to have apartheid in health continue. And all of us, Sally, are complicit. All of us, me and you, who carry medical aids, are complicit, and we are co-perpetrators in a crime against humanity. We should stop making it a government problem. Sure, I hear you.
It is privileged South Africa's problem.
Yes, government also, though, has the power to make those changes. But I want to ask you a broader question, because one of the issues that Dr. Ramathuba alluded to was the fact that Emmerson Mnangagwa must start paying us to look after their citizens in our hospitals. And I understand that there is some sort of discussion around collective healthcare within the region. Now, you sitting as the president of the Association of Medical Councils of Africa, is that debate well underway? Or is South Africa, even with our government hospitals that are ailing, are we still seen as the place to come? And that's not going to stop until we make some big regional policy changes?
We live in a global world. And that issue of regionalization, putting ourselves in a pigeonhole, is not going to work. All that South Africa has to do is to be a decent, good international citizen that upholds the rule of law in its own country, that secures its own borders, that does its job of governance and governing itself and being a nation that has laws that its citizens respect, that respect itself and secures its borders. Just like it happens anywhere. And you come in as a foreigner on a temporary basis, you need, one of the assurances you need to give is, can you take care of yourself medically? Just like all of us are subjected to when we travel to other countries. Do you have health insurance? So we can't create this issue where we now want a Mnangagwa or a foreign president to take responsibility for our incompetence in governing ourselves as a nation and securing our borders and upholding the rule of law. This is pie in the sky that you'd expect a president in a country to have a citizen that knows they are violating the laws of South Africa, and it is South Africa that lets them get away with it. And then you want a president elsewhere to take responsibility. Yeah. That's madness.
Yeah, I hear
cowardice.
You. I think we also need to acknowledge that, I mean, certainly I don't know about that woman. She may well be sitting with a visa to legitimately be in South Africa. We simply don't know. We also know that people who seek asylum in this country often spend months trying to get those asylum papers from Home Affairs. So your point is well made, that we need to be looking at making sure that our laws are rock solid and they work properly, not blaming people who end up sitting in a hospital bed. But you've made some really excellent points, and I really want to thank you very much for your time, Dr. Kgosi Letlape. He's president of the Association of Medical Councils of Africa.